Greetings, students. Welcome back to our podcast. So today we are going to speak about the rotavirus. We are the Pod Squad, and I am Dr. Bridgewater.
I'm Dr. Moore.
I'm Dr. Rivera.
And I'm Dr. Agason.
To give a little background about what the rotavirus is, it is a highly contagious virus that primarily affects infants and young children, causing severe diarrhea and dehydration. There are 9 species, including type A, B, C, D, F, G, H, I, and J. The main type is type A, which is 90% prevalent among human beings. It's the leading cause of gastroenteritis in young kids, spreading through contact with infected stool or contaminated surfaces. Symptoms like watery diarrhea and vomiting usually show up 1 to 3 days after exposure, with infants around 6 months to 2 years old being the most vulnerable, especially if they're malnourished. The main treatment focuses on hydration since there's no specific antiviral treatment available. However, a vaccine exists that significantly reduces severe cases. Understanding the contagious nature is crucial for preventing outbreaks, and usually in crowded settings like schools or the daycare centers. Quick diagnosis and effective home care practices like using oral rehydration solutions are essential in managing the infection and preventing severe dehydration, which can be life-threatening.
The next morning.
To figure out the most effective way to prevent rotavirus, we will use a double-blind case study. When it comes to the methods of prevention, other than your conventional washing your hands and washing your food, there's another prevention option. The oral vaccine is used to protect children. So actually, in this case, we will be testing the validity of the vaccine and how effective it is. In this case study, we will have 100 and get 50 of the vaccine and 50 of placebo, so nobody will know who has it to prevent bias. After giving the vaccine, we will mildly expose the children to the virus and will test and see which children contract the virus and which don't. In this experiment, the independent variable will be rotavirus and the dependent variable will be the vaccine. If a higher percentage or equal percentage of children that got the vaccine contract rotavirus, it will show that the vaccine is ineffective. If more children that did not get the vaccine contract the rotavirus and not many that have the vaccine do, then it will show the vaccine is effective.
The results. The independent variable is whether the child receives the Rotatech vaccine or a placebo. This is the variable you are manipulating to observe its effect. The dependent variable is the outcome measured after the exposure to rotavirus, which could include infection rate, the percentage of children who got contacted with the rotavirus, symptom severity, levels of symptom, mild, moderate, severe, and the effect of children, duration of the illness, how long the symptoms lasted, hospitalization rates, the percentage of children who required hospital care. The control variable are factors you must keep constant to ensure valid results. The age of the participants. All participants should be healthy infants aged between 6 to 12 weeks at start. The dose schedule. Both vaccines and placebo groups receive 3 doses at the same intervals. Exposure conditions. Controlled exposure to rotavirus must be the same for all participants. Health monitoring. Use the same criteria and procedures to evaluate symptoms and outcome across both groups. Blinding. Neither participants nor researchers know who received the vaccine or placebo to prevent bias. Rotavirus infection rates. The vaccine group shows a much lower infection rate, 10% compared to the placebo group, 50%. Severe cases among the affected, only 2 severe cases occurred in the vaccine group, while 20 occurred in the placebo group. Hospitalizations due to rotavirus. Hospitalizations were significantly fewer in the vaccine group, only 1 case, compared to the placebo group, 15 cases.
In conclusion, the rotavirus continues to be a major objective of eliminatory sickness and dehydration in young children. While understanding the pathways of transmission and carrying out preventive instructions such as updated vaccinations, healthy hygiene, and accessible to clean water are climatic footsteps in being able to limit the load of these infections. Prioritizing these plans of action, we can keep hold to our vulnerable community, especially those in areas with little to no healthcare access, and further build up to the abolish of the rotavirus. The public health attempt, reliable research, and education are a primary tool to secure this unfortunate spread of these foreseen counts and to expand our plan to decrease the collision of this disease on children worldwide.
To improve outcomes and reduce rotavirus cases, we can take several impactful steps.
The first step is expanding vaccine access. Make vaccines available to low and middle communities, addressing financial and healthcare barriers to ensure everyone in need has access. Number 2, promote sanitation and hygiene. Develop campaigns to encourage clean water usage, proper restroom etiquette, and effective cleaning practices to limit rotavirus spread.
Number 3, enhance data collection. Use detailed surveillance systems to track outbreaks, test results, and vaccine effectiveness, identifying trends and patterns for better response.
Number 4, educate the public. Raise awareness about rotavirus and preventative measures to empower communities to take action.
Number 5, develop treatments. Focus on improving care for infected children to reduce severe cases and hospitalizations.
By taking these steps, we can better understand tackling rotavirus, ultimately creating a healthier community and reducing infections worldwide. That is the end of our presentation. Here goes our resources. Again, this is Dr. Bridgewater,
Dr. Moore,
Dr. Rivera,
and Dr. Agason.